This video will show you how to set up the Alcon Centurion system for surgery. We'll demonstrate opening the pack, inserting the cassette, and putting the bag into the drawer, and also priming and then tuning the handpiece. What we're going to demonstrate now is putting on the Mayo cover. If you'll see on the left-hand side, it says place hands under the cuff. So we take our hands and place them underneath. We guide this into the system, and then with our hand under the cuff, we can now grab this edge, pull it out, and then guide this back onto the Mayo cover. After it's on, we pull this bail out and make a little pouch for holding our handpiece during testing. On the IV bag, you'll notice that there are two rings. If this was BSS Plus, it would have a ring a little further apart. The flash of blue light hits these and it looks at those little ridges and it feeds back to the unit that a IV bag is in place. If you have a software version of 2.4 or earlier, the plastic on this bag is so reflective that it overdrives the reader mechanism. So Alcon has a update 3.02, and that will take care of that particular problem. So when we drop the bag into the holder, close the door, see that little blue flash of light appear. Now we're going to do a close-up of the screen. We have the IV bag in place, and you'll notice it reads it as a BSS. There's no volume showing up yet because the pressure plates have not moved in. They only move in once the cassette is placed in. Next, our cassette. Remove the paper tape. Remove the protective cover. This will plug into the IV bag, which is in the bag holder. The cassette, we pull the cables back, put it down on the base, slide it in. Our tubings we put together. Next, we touch Prime FMS. What this is doing now, the bag is squeezing and it's pushing all the air out of the bag, and it'll be pushed into the collection bag. After that's completed, then it'll open up the valves and fill up all the lines. When the lines are completely filled, then the system will do a check of the vacuum. It's going to see that the connections here are nice and firm, and that there's no leaks, and that the cassette's working properly, and it does this all automatically. The screen itself, we have a remote control that you can use to operate the system, or you can get a Q-tip and touch it, or have a clear plastic sheet over the screen. We don't have a clear plastic sheet over this right now, just for demonstration. Plus, you see I'm not wearing a mask. So this is so that you can hear me through the microphone. So it is now completing its fluid fill, and now if you can see here, the vacuum is increasing as it tests and makes sure everything is functional. When it completes this step, it'll automatically go into the fill mode. So now we're ready to do the phaco handpiece. Now we're going to install the phaco handpiece and put on the tip and do a prime and tune of the phaco handpiece. This is the Alcon Centurion handpiece. It has a protective cap. Pull down on the collar, remove the cap. Be sure not to touch that because that is not sterile. Let the cap drop. Locate the red dot to red dot. Push in till it clicks. Next, we take our phaco tip, test chamber, and sleeves. Now we're going to put the tip on the end of the phaco handpiece. Twist this on till it's snug. tight and then snap it back and then tighten it again. Put your fingers on either side of the wrench pushing forward and then remove the tip wrench. Next we have the tip cap sleeve. The tip cap sleeve has holes on either side. So what we want to do is make sure the phaco tip goes through the distal end and not one of the side holes. So the trick to that is if your tip is curved, you want the holes to be up and down on either side of it, so when it slides through, it exits properly. Then we put our test chamber on. Now that the test chamber is on, we can put our lines. We have two of those. One is irrigation. The irrigation line has a safety latch on it, so when you press it in place, you can rotate this and lock that in place. Next, the blue is the vacuum line. And then next, I'm going to touch fill, and that'll open up the irrigation line, and that way we can fill up the test chamber. And then once that's filled, we place it into the holder here so that it's pointing up. The next step we're going to do is advance to test handpiece. So now what the system is doing is running fluid through the handpiece, and after it has that initial fluid test going, it does a burst of ultrasound to make sure the tip is tightened properly. If the tip is loose, then it will give you an error, loose tip. So everything passed here, and now we're ready to go into surgery. The verified PEL is designed so that you can locate the tray, or actually locate the test vacuum chamber so that it's even with the patient's eye. So by going up or down with the arrows, you can get that set up properly, verify that, and now we're in our surgical mode. That concludes setting up the system for priming and tuning.